The adoption piece, just like with anything, it's complicated from a patient perspective, because when you talk about the adoption of anything, there's cultural elements, there's socioeconomic elements, there's access elements. And so I think although patients for the most part were very eager to use telemedicine and have really embraced it, there's obviously disparities, within that usage. And a lot of that comes down to access. So, is the proper infrastructure in place for all people to access telemedicine? And then do they have the digital literacy to do that? So, are they living in a community, for example, that doesn't have broadband internet? You can't expect someone who doesn't have access to telemedicine to, access it at the same level. And if they do have the infrastructure in place, they still have to understand how that data is collected, the value in collecting the data, and kind of what interpretation to make from it in order for them to participate in the same way. So digital literacy is a big component of, the digital divide, and why we're seeing some communities adopt telemedicine so much more than others.